This video will teach you how to ambulate successfully with tethers. A tether is any line or machine attached to the patient. Some examples of this are oxygen tubing, which is usually in the patient's nose, a Foley catheter, which is usually down low beneath the bed, or an IV pump, which is a long pole that usually administers medication to the patient. Other examples could be EKG leads or feeding tubes. Make sure when you are preparing to ambulate that the pathway that you are about to take is clear, free of any obstructing items on the ground. Also, if you have 2 or more tethers, you should have a helper to help ambulate the patient. Using safety devices such as the gait belts and non-skid slippers are good ways to help reduce fall risk. Also, confirm that the bed is locked and in the appropriate height, which would be all the way as low as it can go. If at all possible, you should limit tethers by talking to the nurse and asking if certain tethers could be disconnected for the time of the walk. Communication is key before ambulating a patient. Try to limit the number of tethers by talking to the nurse and seeing which tethers could be disconnected during the time of ambulation. Usually, a saline lock could be applied to an IV for a temporary disconnect. You can also shut off feeding tubes for the time being. A tether check is also very important. Don't forget to check the Foley and make sure that it's not pulling on the patient, because this could cause a lot of pain and discomfort. Ask the nurse how many lines or tethers the patient has to prepare yourself for ambulation. Communicate as a team, and if needed, ask a second nurse or tech to help you with additional tethers such as the O2 tank or follow you with a wheelchair. When ambulating with the patient, the Foley bag must remain below the waist of the patient to reduce the risk for infection. If the patient is using a walker, you could hook the Foley bag on the side of the walker, which would reduce the number of tethers that you have to carry. Make sure the oxygen tank is in your non-dominant hand, so your dominant hand can remain on the gait belt of the patient at all times. Communicate directions to the patient so they know the plan. Also have a backup plan and have a second nurse follow you with a wheelchair in case the patient becomes tired. Also assess the patient's ability to ambulate frequently and ask them if they are feeling fatigued and need to sit down.